A new study says that those belonging to the baby boomer generation are living longer than previous generations, but have worse health. That's why we're working for you and sitting down with Dr. David Geier about what this study means. Thanks for joining us this morning.
Thanks for having me.
So tell me a little bit about baby boomers. Why are we seeing this?
Well, it's really crazy because for generation after generation, in the last hundreds of years, we've gotten progressively healthier. The lifespans have gone up. And in baby boomers, and this new study shows it, the life expectancy of baby boomers is still going up. The difference, what this study found, is that despite the fact they're living longer, overall their health is worse at the same ages as the greatest generation before them. So yes, they may live longer, but they're going to have more years of chronic disease and disability.
And at a time where we have the most information at our fingertips, what are some ways to help this statistic?
Yeah, that's what I think is what's really frustrating. This study didn't really look at the why. This is sort of a statistical study of hundreds of thousands of people. But what you can really sort of take away from this is we've gotten much better at treating illnesses, medications largely, and that's great, but that's one part of a bigger picture. And I'm not saying we shouldn't use those treatments, but we've got to get back to prevention and figuring out what we can do to prevent these chronic diseases, the obesity, the diabetes, the high cholesterol, the heart problems. And that gets, like we talk about with a lot of these interviews, exercising more, which we're not doing as much, and eating better, and we're not doing that as much either. Looking at really how we can prevent these problems is going to be more important as we get to Generation X and the millennials and Gen Z.
And I was just going to say, mention Gen X slightly.
Yeah.
Is this a trend that we could see over time? Hopefully not. But is that something that we're seeing yet?
It definitely looks like it. As you mentioned, the Gen Z sort of crept into this study. This was done over 14 years, 2004 to 2018. So the Gen Z, the 40s and 50-year-olds, or Gen X, I should say, started to creep in it to the end. And what they found, at least in terms of obesity, diabetes, and poor mental health, they were more likely to have that than baby boomers at the same age. This is what's called a generational health drift, meaning that the generations get sicker at the same ages than the generations before. This study didn't look at millennials, but we worry about that. We've seen the obesity rates go up in some of these chronic diseases. So yes, some of the risk factors, the lack of exercise, the poor nutrition, very likely drift into younger and younger people.
And lastly, when you say that they live longer, but they might have more health problems, that's interesting how those go hand in hand. You wouldn't expect them to.
No, and there have been some concerns that Gen X, again, the 40 and 50-year-olds, are going to be the first generation in hundreds of years that the life expectancy actually drops from the one before it. We'll see. That obviously has to play out. But again, with rising obesity rates and diabetes that lead to so many other issues, that's certainly a problem. And so I bring this study up not to necessarily be discouraging. It's, yes, there are things you can do to treat diseases with medications and everything else, but it also gets back to taking control of your health on your own level, the exercise, eating better, finding out what's in your food and trying to eat whole foods that don't have the chemicals. All of that probably plays a role.
All right, great advice. Thank you so much for joining us this morning.
Thanks.